Doc, we're now government is now contemplating allowing face-to-face classes in low-risk areas. We have to emphasize that. Your thoughts on this?
Well, the first thing is that the requirements would be there should be lower number of cases in the schools or in the LGU where the academic institutions are actually located. Number two, we need to ensure the safety of the teachers as well as the students. Number three is about the infrastructures. Are the infrastructures ready right now? Whether they would actually change the standard designs in order to adjust to the new normal. And number four, will the DepEd work with the DILG in case there will be problems? So these are questions that we need to answer. And perhaps number five, as a suggestion, is to do a pilot study in certain academic institutions where you can easily close down just in case there will be a surge in the number of cases. And this has been done in other countries, particularly Korea and Singapore and other areas. So I think these are basic questions that we need to answer before we actually start with the face-to-face sessions in the educational area.
And Doc, another basic question. Malinaw ba yung definition ng low-risk area? And if so, what is it?
Well, I always base my definition based on what the OCTA, because every 2 weeks the OCTA research group would give me, and I would actually follow them based on their attack rates, their hotspots, and everything. And they're really accurate in actually projecting the particular hotspot. So to me, the hotspots right now would be, of course, we're in a downward trajectory at the National Capital Region with some certain areas. Not for today. There are 4 National Capital Region cities right now with active. We have the Calabarzon, and then you have the Central Luzon. And in the peripheral areas, you have problems, of course, in Davao City, some areas Iloilo or Cebu. So I think we need to understand that if ever we would do this, we need to check, of course, the number of cases and the surges. The other area that they need to check on is in the northern Luzon, Pangasinan, Benguet, Isabela, and Cagayan, because of the post-typhoon unintentional breach in the protocol for the social distancing. And of course, because of the holiday rush, they need to consider them as well.
Do you think this might roll back gains in the transmission?
Well,
Do you recommend that they push through?
Professor Guido like to address that, or I can do that?
Whoever is okay, Professor.
Yeah, okay.
Do you recommend?
Well, if they do it in low-risk areas, of course the risk is not quite significant. So, they can always pilot test it. And I don't know the exact specifications that they're having for face-to-face classes. Will they be reducing the number of students inside the classroom? Will there be social distancing? I mean, of course, we know that, and it has been shown that kids and minors can actually be spreaders, because previous studies have shown that maybe they're not, but more recent studies have shown that minors can be spreaders as well, and that could be a problem, because as we know, the thing with minors is it's harder for us na pagsabihan sila to wear face masks. They will probably wear face masks, but sometimes they may not be so conscious of what they're doing, like playing with their hands. Their hands could be dirty. I mean, at least adults must naiintindihan natin the logic behind wearing face masks. So, but we're not exactly opposing this for low risk areas. And I think eventually we have to move in that direction anyway. So we're interested to see what will happen in these, sort of tests that they're going to be conducting in certain low-risk areas.
In some countries where they open school, every open schools, they are using plexiglass dividers, but there's some controversy on the usefulness of those dividers for containing the virus. Would you recommend the use of those plexiglass dividers?
Well, it really depends, because if transmission is primarily through droplets, then the plexiglass dividers would be more effective. But there is data now that says yes, it's from aerosols, which means it's from smaller particles that are simply staying in the air. And little children, when they're playing, are going to be coughing. There's a lot more aerosolization. So the question now actually is, in the context of the Philippines, where it's warmer than in the States, where our children are more crowded because, teacher to student ratio is much, much higher here in the Philippines than it is in the West. So how are we going to control for density of students in the classroom and making sure that, when they pass each other, they are not touching each other and giving each other a high five and transmitting virus that way. So there are added challenges, but throughout the world, different societies have tried to see if they could reintroduce face-to-face. So I don't think we are opposed in principle to that. Again, it's a matter of timing and place, right? So you don't want to do that in the middle of a wave. So as we are talking primarily about the wave, we would say, well, you have to pick a province or a region which is relatively cold and see if we can test it there.